Hi, welcome to week 9, part 2 in healthcare delivery systems. Today we're going to look at the HIM profession. And the reason we're looking at this is I know that as a new student you attended the orientation for the program and they talked a little bit about this. But comments and feedback that we've gotten from graduate surveys have indicated they'd like to know a little bit more about this in the first semester of the program. So first off, I'm going to talk about the health professional or the HIM professional. And we're going to look at how it was developed. What is the HIM professional? What is a HEMA? What is the accreditation process for education programs? So here's a little bit of history about our profession. Back in the 1800s, 1920s, hospitals were loosely organized, and as loosely as they were organized, so was the records that were kept on patients. Many physicians, they just kept notes on their patients of what kind of care they give, but there was nothing formalized, so it was really haphazard. Well, there was a gentleman named Abraham Flexner, who in the early 1900s actually did a study of hospitals, and what he basically found was that they were in a deplorable state. So he wrote a report, it got a lot of attention, and the result was in 1918, there was formed the American College of Surgeons, or the ACS. And the reason this was significant, it was for the first time that minimum standards for quality standards for hospitals and surgical procedures were developed. And as part of that minimum standard, they were the first organization that said you had to have some requirements for a health record, and that there should be some organization to it. So really that was the birth of the HIM profession. So at that time then, about 10 years later, there was a group called the Association of Record Librarians of North America. And this was actually started in Canada. It was 35 members, started in 1928. Well, then they thought, okay, this is what we do. We're record librarians. Basically, they were librarians of the medical record. They said, we need to train people on how to do this. So they developed their first curriculum in 1932. Then in 1933, they had a baseline accreditation for members. And then by 1941, there were 10 schools across the country where you could actually come and study this profession. Now, keep in mind that HIM wasn't the only profession organizing at this time. Standardization of hospitals impacted a lot of different professions. So nursing was becoming more organized, x-ray tech, lab tech, and other allied health professions. So our practice or our organization evolved, and in 1944, they changed their name to the American Association of Medical Record Librarians. That's a mouthful. Then in 1970, they changed their names to the American Medical Record Association with AMRA. So this is how old I am. When I actually started in this profession, it was called AMRA. Now, I wasn't here in 1970, but when I became a student in 1989, it was called AMRA. Eventually, though, it changed its name, and we'll get into that a little bit more. But they changed it to the American Health Information Management Association. That was in 1999. And then they changed the titles of our credential to a Registered Health Information Administrator, which is a 4-year degree, or a Registered Health Information Technician, which is a 2-year degree. Prior to that time, you were called an ART, which was an Accredited Record Technician. So we've been called RHITs at the 2-year level since 1999. Job settings for our profession are varied. The most common job setting for our graduates are acute care hospitals. They can also work at integrated delivery systems, multiple providers. We have had grads who work in long-term care. We have had grads who actually work for vendors and they go out and sell products like software, or they demo that. We've had grads work for insurance companies, most usually in the area of third-party billing specialist. We've had grads who do consulting, grads who become educators, and then we have grads in law and government agency, not too many in pharmaceutical companies. Now, in acute care hospitals, the roles that we have played, it's not just in the health information department. Our grads work in compliance, they work in quality management, they work in billing, they work in research. We also have grads who work as tumor registrars. We've had grads who work in trauma registries. So the job settings can vary greatly. The thing you need to know is that the program itself in the 2 years doesn't just train you to be a medical coder. Your skill set will go beyond that of a coder, and you can apply those skill sets in many different arenas. The one thing I remember as a student was the faculty always said, when you graduate, you're going to be able to do this. And when I was a student, I was sitting there thinking, oh yeah, that's right, that's not going to happen. But I soon learned after my professional practice experiences and being on the job that you really know more than what you think you do when you graduate, because what you learn in 2 years is a good, solid foundation of what you need to know. And not only what you need to know, where you can look for the answers that you need to do your job. So here's an example of job titles that you can get in the HIM profession. You can be a director, you can be a registrar, privacy and compliance, consultants, coder, a clinical documentation improvement specialist or a CDI specialist, a reimbursement specialist, claims coordinator, revenue manager, research quality management, many, many more. Our skill set is evolving. Health information now with the electronic health record goes beyond the HIM department. So as an HIM professional, you're going to be able to extract that information. You should be able to manipulate it to get it into a report or a format that people need to know. And you will be able to provide data that will focus on the organization's information needs. So as an HIM professional, the more you can evolve your skills in the area of database management, data manipulation and extraction and retrieval, the use of that data for analysis, your skill set will grow quite a bit. We also are an information-based role, so we look at a standards developer. What are the standards for the department? You can be an information-based role in the role of a chief privacy officer or the CDI or a clinical vocabulary manager or even a chief information officer in a healthcare facility. So the job skills for the future, in other words, the job skills for now, these are the skills that over the course of the program, the essential skills that you need to be successful. You need to learn what you can about the electronic health record management. So the more you work with this on your clinicals, the more you practice with our simulated software in the program, the more you practice with the encoding system and know how to use that, it's better that you are. But not only how to use it, you need to understand its purpose and what you can do with that. You also need to be very good at managing information privacy and security. You need to understand HIPAA, you need to know the privacy standards, and you need to know how to maintain a secure record. And by the end of the program, you should know this. You need to be able to think analytically. So some of the discussion questions in this course and other courses that you take, really, we want to focus on your ability to think analytically. What would you do? Is this right or is this wrong? Critical thinking. Can you take data and can you interpret it and can you draw a conclusion from it? So those two things are important. Ensuring data integrity, that's maintaining the data integrity of that record is what it says it is. Problem solving skills. Are you good at solving problems? Problem solving doesn't just relate to finding answers in the course-room. Problem solving skills involve everything you do in an online course, like learning how to find the resources that are provided in that course, learning how to use those resources to be a better student, learning how to use all the tools that you can to be better. Communication skills. You'll notice in your course room, especially your discussions, where it says use complete sentences or in 3 sentences do this. Your ability to communicate in the written word is very important. Your ability to express your thoughts in a written word or orally is very important, because in the work world, you're going to have to talk to other healthcare professionals and or patients and or residents, and you need to be able to express yourself. Not only express yourself appropriately. Clinical documentation improvement. Documentation drives reimbursement, and the HIM professional needs to know the correct documentation that will keep that hospital revenue stream going and yet keep it within the guidelines of the rules. Leadership skills. Whatever you can do as a student to develop your skills, do it. Do not be shy. And then data analytics. Using that data in the health record to become a better student, to professional, to help your organization achieve its goals. So those are some of the skill sets for the profession. Our professional membership organization is AHIMA, and the definition is there. AHIMA has a code of ethics that we all live by, and you'll see that in legal aspects of health information. But the code of ethics, as a member, we swear to protect the privacy and the security of health information, and also follow the regulations and standards established for us. Our membership status, we have a student membership, which you will join, to an emeritus status, and those are people who are now retired but still want to retain their membership. I am an active member of AHIMA as well as the other faculty in the HIT program. The credentials. Now, the one thing that makes us a little bit different than, say, nursing, an HIM person does not have to be licensed in any state. So you do not have to be licensed to practice your skill. But what we do have is a credential. So you may get hired by an employer who doesn't care if you have that credential behind your name. Other employers care very much that you have that credential by your name. What we share with our students, you work 2 years to graduate from this program, and you put in a lot of blood, sweat, and tears, and you deserve at the end of your program to write that test to prove your skills to become a credentialed RHIT. The only way anyone in the United States can become an RHIT is that they have to graduate from a 2-year accredited program like ours. There's about 300 programs nationwide, but that's the only way you're going to get that credential. We have had students graduate who don't get the credential, and usually they'll call several years later, geez, I should have done that. What do I need to do now to get it? We've had an employer tell us once they did not hire a student because the student didn't get their RHIT. And their attitude was, if you didn't have the motivation to get the RHIT or write that exam, how do I know that you have the motivation to work for me? So I always encourage graduates to write that exam to get their certification. You didn't work 2 years not to do it. You went to school for a reason. You went to this program for a reason. So it's important. Other credentials offered by AHIMA, they have a certified coding associate. That's just a basic entry-level coder. I'll tell you, it's a hard exam, but you can take a CCA with no education. There you have a certified coding specialist, physician-based. You can become certified in healthcare privacy and security, health data analyst, clinical documentation improvement practitioner, or a certified healthcare technology specialist. Most of those certifications you have to have so many years experience, it depends, and maybe a degree requirement, but most of them is years of experience and practice. The RHIA and the RHIT are the most recognized. The RHIA is the bachelor's level of HIM. So, for example, let's say you graduate from a 2-year program and you want to get a bachelor's. There are many programs across the country that will take your education from the 2-year program and it'll assimilate right into their 4-year degree so that you're able to finish. When you become a member of AHIMA, you get access to their information, their journal, and job postings. And these are related professional organizations to AHIMA. The most common one is the HIMSS. It's actually our chief rival. and that's really technology based. Okay, I'm going to stop here so the rest you just look at, but this is